In this lecture, we're going to be looking at lots of parasites. So there are a lot of parasitic diseases out there. There are parasites worldwide. You cannot avoid them. Now, because there are so many different types of parasites, we divide them up into two groups. So I've got two different recordings, the protozoan parasites and the helminthic parasites, more commonly known as the worms. Now, they're usually more common in rural, undeveloped, and overcrowded places, but we'll talk about a couple that are not only found in those particular areas, are more common in those. Now, many parasites have several hosts that they have to grow in and even mature in. A definitive host is one that it finally reaches its full maturity, usually sexual maturity, so it allows it to have some type of offspring. And then they usually have to go through multiple intermediate hosts. And it's during these intermediate hosts that they are going through different stages of maturation until they eventually can make it to their definitive host and eventually make it to full maturity. Now, just based on my picture, there are a lot of ways in which humans can acquire parasitic infections. We can inhale them. We can get them in our eyes. We can get them in through various types of insects. We can get them, some can just burrow right through our skin. Some are sexually transmitted, but you know, the biggest group, just like with bacteria and a bunch of viruses, fecal oral. So again, lots of parasites we're going to cover, and this is not even close to all the parasites that are out there. We're going to talk about the most common ones that either you or your patients may encounter. And we again divide them into the two groups, the protozoans, which I'm going to talk about in this lecture recording, and then the helminths, which I'll talk about in the next recording. So our very first group are protozoan parasites. They are all unicellular eukaryotes. So they are eukaryotic cells, so an advanced cell, but they are still single-celled organisms. Now, when they are ingested, there are two possible forms that they can be found in. Is the trophozoite, which it is actively feeding and reproducing in the host, and then the cyst stage or form, which is the infective form. This is one we can find out in the environment, and then this is the one that we acquire. We drink contaminated water, or we somehow pick up the cyst. That's the one, it's infective. It can survive for longer periods out in the environment until we ingest it. Now, because there are so many protozoans, how we group them is usually based on how they move. So we like to group our protozoans based on, do they move because they have cilia? Do they move in an amoeboid fashion? Do they move because they have flagella? Or do they have something known as an apicomplexan, which is some complex structure that allows them to move or attach, or some unique characteristic. So we're going to start with the ciliates, and if I go back to our little flowchart, we're literally start at the ciliates and make our way through the four different ways they can move. So starting with the ciliates at the very, very top, there's only one ciliate protozoan that causes disease in humans. It is the Balantidium coli. Now, if we shorten that then, and we shorten the Balantidium to the B, its official name is B. coli, which should sound kind of familiar to E. coli. So coli, again, is just representing the name that E. coli is found in the colon or the intestines. Well, Balantidium coli, it's not a bacteria like E. coli. It's a protozoan, but it is still tied to the intestinal tract, specifically animal intestinal tract. How we as humans get it is by drinking contaminated water or eating contaminated food that has that cyst stage in it, aka it's fecal oral transmission. Now, healthy adults are usually asymptomatic or with a very minor diarrhea. But if you're in poorer health, or specifically those AIDS patients, that's when you can develop balantidiasis. This is when you have persistent diarrhea, possibly bloody mucus, abdominal pain, weight loss. It resembles that Campylobacter a lot. Now, one ciliated, and we're moving on to our amoeboids already. and there are 3 amoeboids. Again, they move in what's known as an amoeboid fashion. They are generally tied to watery environments, and they send out these called little pseudopods or fake feet, and they kind of ooze their way wherever they need to go. So they kind of move around and ooze to acquire their food. There are a lot of different amoeboids. If I went out to the Mississippi or to a lake and got a sample of water, I'd probably see some amoeba in it. Those generally don't cause disease, but there are a few that we will talk about that do cause disease. The first one is entamoeba, so it even has that name amoeba in it. Now, it is actually carried asymptomatically in about 10% of the population in the world in the digestive tract. So some of you may have this particular amoeba in your intestinal tract and it's not doing any issues. We usually see more cases of it, even being part of the normal flora in less developed countries than more developed countries, because it's picked up by drinking contaminated water. Again, contaminated fecal oral means it's got that cyst in there, and here in the United States, usually people are drinking pretty clean water, but not always. Now, if you have this particular amoeba in you, you have amoebiasis. If you have luminal amoebiasis, it's asymptomatic. It just means it is living probably as part of your normal flora in the lumen, that opening, the inside of your intestinal tract, not causing any issues. It can, however, not always, invade the intestinal wall, and this is then called invasive amoebic dysentery. It's going to cause symptoms like dysentery, but it's not dysentery. But again, it's invasive because it's invading that intestinal wall lining, and it's an amoeba, so it's invasive amoebic dysentery. That's going to cause severe diarrhea, appendicitis, and even ulcers in that intestinal wall. If it gets even farther, if it gets into the bloodstream, now you have invasive extraintestinal amoebiasis. Extraintestinal, extra means outside, so this means it's now left the intestinal wall lining, travels in the bloodstream, and it can destroy tissue in the lungs, the spleens, kidneys, and brain. It can be fatal. That doesn't happen very often. It's probably caught in the meantime, and people that generally have healthy immune systems usually have luminal amoebiasis, asymptomatic, or a minor amoebic dysentery. It's usually the more severe immunocompromised, higher dose, or that it can cause more severe complications. Best prevention, clean water, that you're not drinking fecally contaminated water. The next 2 amoeba I talk about together because they both are found in the same locations, picked up in pretty close the same way, and they both are causing the same kind of issue. So there's an acanthamoeba, again it even has an amoeba in its genus name, and Naegleria. Both cause rare fatal brain infections. Both are found in natural and artificial water systems. So when I say natural water systems, we're talking about lakes, warm lakes, they don't like freezing temperatures, ponds, puddles, artificial water systems, swimming pools, humidifiers, air conditioners, even a neti pot would all be considered in that artificial water system group. Now, acanthamoeba enters in the body through any kind of open wound, so any kind of cut. It can get in through the eyes, but it's most commonly picked up when you inhale it when swimming, meaning you are swimming and water goes up your nose and you inhale it. Now, if it's picked up through the eyes, it can cause a condition known as keratitis, which can cause damage to the cornea to the point where you actually have to have cornea replacement. People that wear contact lenses constantly rinse them with tap water, especially if tap water is well water, are more at risk for that because, again, this can survive in artificial water systems. Once it gets into the body, it travels to the brain and it causes amoebic encephalitis. And encephalitis just means inflammation of the brain. Amoebic is because this is caused by an amoeba, something that moves in an amoeboid fashion, and it leads to death within weeks. The Naegleria, again, still found in the same type of water environments and still causes rare, luckily, fatal brain infections. And it's usually picked up just primarily by inhaling, so not usually picked up through the eyes. It again affects the brain and it causes amoebic meningoencephalitis. It's inflammation of the brain and the meninges, and it works even faster than the acanthamoeba. Usually, acanthamoeba, it's death within weeks. This Naegleria usually causes death within 3 to 7 days of symptoms. Now, it's rare. We don't see a lot of cases. Maybe in the United States, about 3 a year. So, usually. Problem is, it is very fatal. In the last 60 years, we've had 143 cases, and all but 4 have died. So that's not great odds of survival. The treatments, the best treatments we've got some antifungals. That seem to work. Even though this isn't a fungus, it seems to at least decrease it to give you a better chance. Now, the most cases are in farther and southern states, and mostly it's because it does not like the freezing temperature. So we are not swimming, 9 months out of the year out in the rivers and lakes outside. It can, however, still survive artificial water systems. So we've had cases in the states around here. We've had cases in Minnesota. I don't know if I could say we've got cases in Wisconsin. I'd have to look back and see if we're one of those 143. If it is, it's been a long time. But it has been tied occasionally that water parks have had them, that it can survive even low doses of chlorine. Our third group, and we're getting bigger groups, our third groups are the protozoans that have flagella. So they have at least one flagella, depending on how many they have. Do they have one? Do they have multiple? It can help determine which organism we're looking at them, or determining which and how many flagella they have and where they are can help us determine which organism they are. The first one, ignore the page number, is Trypanosoma cruzi, which causes the disease Chagas disease. Now, it is most commonly found in Central and South America, although we do have cases here in the United States, in Southern California and Texas. It is spread by the bite of an insect called the kissing bug. The official name is a triatoma, but why it's called the kissing bug is that it does feed on our blood, and where we have blood very close to the surface of our skin is right there at the lips. That's why your lips are red. It's because blood cells and blood vessels are right near the surface. So at night, this will come out and feed on your lips. It comes out at night because it's not a small insect. It's quite large, and I would think you would notice that during the day hours if you weren't sleeping. Now, when it feeds on you, it does deposit some of one of the stages of this particular protozoan into your blood. It will then travel through your blood. It will kind of grow and develop, because again, it goes through multiple stages as it's developing. But one of the places it does like to grow and develop is in cardiac muscle tissue. So we can see it's got those striations and it's branched, and it transforms into this flagellated stage. So it's got one flagella on it, and it's this that hangs out then in your blood vessels. So once it leaves your cardiac tissue, it hangs out in your blood vessels, waiting to get picked up again by another bite of a triatoma and complete the whole life cycle again. Now, what this can cause, it can go through 4 stages. The first stage is the acute stage, also known as shigomas or swelling at the bite site. So if you're bitten right there around your lips, you're going to have a big old shigoma or big swelling at the bite site. It can then lead to what's known as the generalized stage. Again, you are under attack. Here you can actually see the flagellated amastigote stage underneath the microscope. Super easy to diagnose. The generalized stage is, again, your immune system is now kicking in because you're under attack. You'll have fever, swollen lymph nodes, and large spleen. The asymptomatic chronic stage is what can go on for years. This is the point where your body has gotten rid of the parasite, your immune system got rid of it, but this was still living in your blood vessels, this was living in your heart tissue, and it did some damage, but you're just not outwardly showing that damage yet. Eventually, as again your body starts to decline and your heart starts to decline, that damage that was done to your heart now starts to become evident, and you can develop congestive heart failure. So the leading cause of death in Latin America is congestive heart failure, and not because they eat unhealthy. It's because of this particular parasite that causes that long-lasting damage to the heart. Treatment, we actually have some antibiotics that can treat it, even though again it's not a bacteria, it can still damage the organism. Best prevention is insecticides. You know, if you're going somewhere having bed nets at night, just to avoid picking it up altogether. Again, to diagnose, super easy. You can easily just get a drop of blood, during a blood draw, and look at it underneath the microscope. You can see these are all the red blood cells. We did stain this to make it the organisms look purple, but these are all your red blood cells, and you can easily see these flagellated stages in the actual blood itself. Our next of our flagellated is Leishmania, which causes leishmaniasis. It also is found in tropics and subtropical regions. Its main hosts are dogs and small rodents. How we pick them up are little flies, little sand flies that bite these dogs and small rodents and then bite us. So they're our transmission sequence. It does have two developmental stages. There are amastigotes. It develops in macrophages. So these macrophages, these big eating white blood cells, eat them, but they don't get broken down like they're supposed to, and then they grow and develop and divide. So we can actually see here's one of our white blood cells, and it's just mass-produced number of amastigotes inside of it. Once it leaves there, it will develop even further, and it can develop in the sandflies into the flagellated stage, which are the promastigotes. Now, when picked up, what are the things that you can develop? So you can develop cutaneous, mucocutaneous, and visceral leishmaniasis. Cutaneous, again, based on its name, it affects the skin. It causes skin ulcers at the bite site, might lead to secondary infections if not treated. It can then lead to what's known as mucocutaneous, which is what's being shown on this picture. It causes the skin lesions will start to enlarge, and then it starts to affect the mucous membranes of the mouth, the nose, and the soft palate. So it becomes extremely inflamed, and it starts to cause kind of external scabs and damage and lesions at those areas. It can get into the liver, the spleen, the bone marrow, the lymph nodes, and travel and cause issues and damage to those organs, which then is visceral leishmaniasis. If left untreated and it's now spreading throughout the body, it's extremely fatal. It's usually 95% fatal if left untreated, if it gets to this point. I would like to hope that by the time you've got cutaneous or mucocutaneous, you're going to the doctor to get some type of treatment. This is showing the life cycle. So again, the sandfly bit some infected animal, some type of dog or rodent. It then bites you, depositing that flagellated promastigote into your blood supply. It gets eaten as it's supposed to. That's what our immune system is supposed to do. But it doesn't get broken down. It transforms and starts to mass produce. It gets back into the bloodstream, gets bitten possibly again, and starts the whole life cycle all over again. So treatment, we do have some treatments that work pretty well that are on the market. Our best prevention is limit your contact with dogs and rodents in areas where it's endemic. Make sure you've got insecticides to prevent getting bitten by those sandflies. Our third of our flagellated organisms is Giardia intestinalis, which causes a disease known as giardiasis. It is found in the intestinal tracts of animals in the environment. How we pick it up is by ingesting cysts in water or food. So again, it's contaminated water or food with fecal matter from animals. Now, once it gets into our body and we ingest the cyst, once it gets into our digestive tract, it develops into the trophozoite stage. The trophozoite stage is the flagellated stage. Now, it looks like it's got two little eyes, but those are not eyes, those are actually suction cup discs that allow these trophozoite stages to attach themselves to the intestinal wall lining and completely coat the intestinal wall lining. So this is an actual picture of the intestinal wall lining covered in Giardia. And if they're covering the intestinal wall lining, you're not getting a lot of food absorption, which means it's going to cause diarrhea. That food's going to go right through you. So it causes diarrhea, it can cause vomiting, it can cause fever. That can last anywhere between 1 and 4 weeks if left untreated. One of the unique things, because a lot of things can cause diarrhea, is that when this particular organism is feeding off the food that you feed it, it does produce hydrogen sulfide, which gives that diarrhea a characteristic sulfur smell. So usually diarrhea does not have a characteristic sulfur smell, or maybe it does like the first time you go to the bathroom, but it's not consistent every time. So this Giardia gives that consistent sulfur smell. So if you are traveling somewhere, maybe drinking questionable water, and now you have diarrhea with a very characteristic sulfur smell, go in and get tested and treated. We do have lots of different drugs that can be used to treat. Otherwise, it's mostly, an anti-protozoan and rehydration. For some, it could be asymptomatic, otherwise very severe diarrhea. That's probably going to send you to the doctor. Best way to prevent it, drink filtered water. You can even get those Brita containers. Those filters will filter those cysts out. Our last of our flagellated protozoans is Trichomonas vaginalis, which can live in the genital urinary system of both men and women. It is an STD, so it can be transmitted via sex. There is no cyst form, it's just always the flagellated form. Now, who it infects is usually those that already have some type of pre-existing STD, like chlamydia or gonorrhea. What it causes in men, it's usually asymptomatic. In women, it causes a condition known as vaginosis, which causes pus and odorous discharge, vaginal lesions, and painful urination. None of that great. Probably going to be going to the doctor to get tested and treated. Again, men, asymptomatic, occasionally some inflamed urethra, some minor pain during urination, but it's usually just worse for the women. How they diagnose, my little YouTube over here, is they can take a urine sample, because it can be found in the urine as it comes out of the vaginal tract during urination. It can be found in the urine. They can also do and get a sample from the vagina, some of the discharge that comes, and just look underneath the microscope. They're flagellated, and as long as they're in some type of, slight moist environment, you will see these things swim around, which you should never have anything swimming around. Prevention, abstinence, and safe sex is going to be the best way to prevent it. And then our last group of our protozoans are the apicomplexans, which means they have some complex of organelles at their apical end, at the tip. Now, most of these are animal parasites with more complicated life cycles, which means they usually have to go through 2 or more hosts till they eventually make it to the definitive host. They can go through, some of them can go through what's known as schizogony as part of their life cycles, which means it's a form, they can do asexual reproduction before they can also do sexual reproduction. Now, the 4 apicomplexans that are most common, so again, it's not all of them, Plasmodia, Toxoplasma, Cryptosporidium, and Cyclospora. So the Plasmodium, most people haven't heard the word Plasmodium before, but you may have heard of the disease that it causes, which is malaria. Now there are 4 main species of Plasmodium that cause malaria. They all do the same thing. They're just slightly different species. They're all found in tropic and subtropic regions, and the reason for that is the vector that transmits this particular protozoan is an Anopheles mosquito, and it's a species that can't survive the freezing winter temperatures. So as long as we still keep having below freezing temperatures, we here in the northern part of the United States should be able to avoid malaria. But if you travel, or you have patients that have traveled to anywhere warm and tropical, it puts them at an increased risk of picking up this particular parasite. Now, the life cycle is, let's say you get bit by an infected mosquito. It's going to be ingesting the sporozoite stage into your bloodstream, and the first place it likes to go is to the liver. It's in the liver, it will start to reproduce, and it undergoes a process known as schizogony. This is producing lots and lots of these. It's almost just like a mass production of these parasites, which then gets released into the bloodstream. Once in the bloodstream, it will actually target the red blood cells. And once it can get into our red blood cells, it becomes another stage. You don't need to know each stage. Just kind of understand it likes to go to the liver, then it likes to go to the red blood cells. And because it likes to live in the red blood cells, it's one of the easiest ways we can diagnose it is we can, again, take a blood draw and look underneath the microscope. And we can look at the red blood cells and we can actually see these little ringed structures in the red blood cells. Super easy to diagnose. But now, if you weren't diagnosed and treated, again, because these are in your red blood cells, another mosquito bites you and drinks your blood and picks it up, and then it goes through the whole cycle all over again. Now, let me get to the next slide. The symptoms of malaria from this Plasmodium can include fever, chills, diarrhea, headache. Because the red blood cells are infected, you now have blood cells that will burst, erythrocyte lysis, and you're losing red blood cells, which are now causing also anemia, fatigue, and weakness. So your immune system's going to be kicking in, but you also have red blood cell loss as well. One of the species of Plasmodium, the Plasmodium falciparum, causes a more severe malaria. It causes extremely high fevers of 107, if not more, which can cause death of brain tissue and can easily cause death within 24 hours of symptoms. The specific species that usually carries the Plasmodium falciparum is usually found in very dirty swamp water, which is why it's gotten the name black water fever. Now, fortunately, if you live in tropic regions where malaria is prevalent, the more often you get malaria, because it can be very prevalent, you do actually start to develop some immunity, and your symptoms are usually less severe over time. Your best bet is let's just not get it in the first place. Limit yourself, limit your contact with mosquitoes, wearing or having bed nets, having insecticide, no standing water, covering yourself, not going out at dusk and dawn, all of those things. And if you are traveling to endemic areas that puts you at high risk, we do have some medicines, some preventive medicines as well. The atovaquone and the chloroquine are both common anti-malarial drugs that you can take ahead of time if you actually think that you're going to be infected. Note about them, there's some pretty strong drugs, so it's not uncommon that individuals that take those anti-malarial drugs end up having some kind of, really weird nightmares and things like that. Our second of our apicomplexans is Toxoplasma gondii. It's the most widely distributed protozoan, but 25% of humans worldwide at some point in their life become infected. So a lot of cases out there. Causes a condition known as toxoplasmosis. The definitive host is cats. That's where it wants to get to. It is not, however, the only host. There are lots of other mammals out there, and birds as well can be hosts, but it would prefer to be in a cat. Now, how do we get infected? Well, one of the top ways we can get infected, but not the only way, is from eating undercooked meat that has this particular parasite in it. But now, as we're not eating cats, it again is not the only way that it's picked up, but we can get it from eating undercooked pork, eating undercooked sheep or lamb. It's found in kangaroo meat. I know that's not super common around here. It's in other animals other than cat. The other way it's picked up that is more common when we're talking cat-wise is ingesting contaminated surfaces that have a fecal matter. AKA you clean your litter box, get fecal matter on you, and you don't wash your hands. Now, most individuals asymptomatic. If you're not asymptomatic, you have toxoplasmosis, which causes fever, headaches, muscle pains, sore throat, enlarged lymph nodes, and eventually, if left untreated, goes away in a few months, all the way up to a year, but it can go away on its own if you have a healthy immune system. So for most of you, it won't cause any issues. Why we do care so much about this particular protozoan, though, is that it can cause very severe cases in AIDS patients, and it is one of those few things that can cross the placental barrier. Like listeria can cross the placental barrier, syphilis can cross the placental barrier, toxoplasma can cross the placental barrier, and it may lead to death of developing fetuses, so it can cause abortions, stillbirths, and birth defects. So this becomes an issue and a concern with pregnant women picking it up. Now, to test for it, we do have antibody tests that can look for the parasite. Best prevention, good hygiene, and making sure you're eating fully cooked meat. Those are, the top two ways we can prevent a lot of things, not just this. Now, some interesting things with the life cycle of Toxoplasma. So its definitive host is cats, but again, it's not the only way. So it can be found in other animals. We pick it up by eating undercooked meat. But if we don't pick it up by eating undercooked meat, we can again pick it up in fecal matter that we're ingesting, one of those cyst stages. Now, how the cats get it? Because when a cat has toxoplasma, it has the cyst form and it's an intestinal tract, but cats have immune systems as well, and cats don't always carry this particular parasite. How a cat gets it is it eats an infected mouse. So this is very common in farms where we've got lots of farm cats and they're eating lots of mice and they all live outside and they all eat kind of anything that's around. So its normal life cycle is just right here. We're just kind of accidental hosts. So what normally happens, we're going to start, a cat was infected. It shed this cyst in fecal matter, and on a farm, cats are just going to go poop anywhere. As mice scurry around eating things on the ground, they then pick up the cysts. But an interesting part is once a mouse picks up the cysts, an infected mouse actually will change its behavior and it will lose its fear response. And so mice will no longer actually be afraid of cats. And so this mice would actually go right up to the cat and be like, hey, how's it going? It loses, it's not uncommon. Lots of parasites can cause behavioral changes in their hosts to help then complete the life cycle. So now this cat's going to eat that infected mouse because it wasn't afraid of it, and it starts all over again. But let's just say that this cat did not eat another infected mouse. Once a cat is infected, it will shed this little oocyst for about 2 weeks after it eats an infected mouse, and then its immune system will get rid of it. So a cat is not always infected. It's once it eats an infected mouse, it's shedding those cysts in its fecal matter for 2 weeks. So you may have heard before that, okay, well, pregnant women shouldn't clean the litter box. Well, it's true. If it does put them at an increased risk if you're cleaning a litter box and you're not washing your hands of ingesting this. However, if you have a cat that never goes outside and you don't have mice in your house, then there is 0% chance that your cat is infected, which means that you're not going to pick it up. But if you do occasionally get mice in your house, I would not clean the litter box. Or if you have a cat that goes outside, I would not clean the litter box if you're a female and you're pregnant. But again, if your cat never goes outside, you don't have mice, you have a 0% chance of picking it up. But if you can get out of cleaning the litter box for 9 months, go for it. Our third of our apicomplexan group is Cryptosporidium parvum, causes cryptosporidiasis. Now, humans and animals are, for a lot of people, asymptomatic carriers. In developing nations, it's not uncommon that you could have up to a third of humans as carriers. How we normally pick it up, if you're not a carrier, is we drink contaminated water that has the cyst form. And it's a fecal-oral transmission, which means you are drinking water that has fecal matter in it. And what it causes, very severe diarrhea. It can also cause headaches, muscle pain, cramps, and of course fluid loss. But that oocyst starts to invade the intestinal mucosa, again, attacking your intestinal tract, which is why you have that, massive diarrhea as your body's natural response to get rid of the thing that's invading it. Now, you can have this really bad diarrhea for up to 2 weeks. It can then go away. Your immune system, in theory, should be able to then get rid of it. But if you are elderly, immunocompromised, or in the AIDS stage, it won't go away. Your immune system can't get rid of it. And then it can be deadly to the point you're going to lose fluids and electrolytes with that diarrhea, that it becomes deadly and life-threatening. Now, in 1994, one of the biggest outbreaks of Cryptosporidium was in Milwaukee. So part of Milwaukee, not even all of Milwaukee, but there was one water treatment facility that didn't do a very good job of filtering and treating the water, and everyone in Milwaukee that water treatment facility provided water to all got sick. They estimate over 400,000 people all got Cryptosporidium at the same time. That's a lot of people with diarrhea. There was nowhere where you could buy Pepto-Bismol or anything to help with the diarrhea. And they did have to set up like army medic tents to be able to treat all the patients. Over 100 people died of this. That means because of the city's water supply, they killed over 100 people and caused one of the biggest outbreaks known with this particular organism. Now, since then, Milwaukee has updated their water treatment facility, and they have one of the most state-of-the-art water treatment facilities in the United States because of that, because they realize that a failing water treatment facility can be deadly. And then our very last of our protozoans is Cyclospora cayetanensis. It's picked up in contaminated food or water that cyst form again. The environmental reservoir where that contaminated food and water came from is unknown. We're not sure if it's a specific animal, lots of animals, like who's contaminating the water. We know that it causes cramps, diarrhea, muscle pain, and fever. Again, it's a fecal-oral transmission, or we're pretty sure it's a fecal-oral transmission from some animals. Usually it resolves itself within days to weeks, but if you are immunocompromised, it causes a more severe disease. One of the easier ways to prevent it, other than drinking clean water, is washing fruits and vegetables. Even cooking and freezing them will kill this particular organism. Again, a lot of fruits and vegetables are fertilized with manure, and if it's coming from an infected animal, it causes you to be at risk. I haven't heard of a lot of cases of this. I think it was a few years ago there was a recall on some vegetable trays for a Cyclospora species. Again, causes severe diarrhea in immunocompromised individuals. We do have to be concerned on how severe that could be. So in your book, It also kind of summarizes some of these top organisms. There's so many more out there, though, that we don't cover, but these are really the most common ones that you may encounter in your future, or maybe you've had some experience with it in the past.